President Trump and top health advisors made a controversial announcement on Monday. They are now urging pregnant women to stop taking Tylenol. They also say not to give it to babies, arguing it could lead to the development of autism. Tylenol has long been considered to be a safe option during pregnancy. Some medical experts are arguing that it still is.
Yeah, that's right. We got 9 News health expert Dr. Paul Coley joining us now to explain a little bit more about all of this. Dr. Coley, thank you for joining us.
Good morning.
First, why is Tylenol considered the safer painkiller? What about, Motrin or Aleve?
It's funny, even in non-pregnant patients, it's actually considered safer because non-steroidal anti-inflammatories like Motrin, Aleve, ibuprofen, they can have a lot of health effects. So they can disrupt the lining of the stomach, cause bleeding in the stomach, raise your blood pressure, cause salt and water retention, affect blood flow to the kidneys. And in pregnant women, especially later during pregnancy, they can lead to complications like low amniotic fluid and premature closure of something called a ductus arteriosus, which is one of the plumbing things in the baby. So it's really not advised to take non-steroidal anti-inflammatories in pregnancy, which is why we've leaned on Tylenol so much as sort of the safer alternative for pain, for fever, for headaches, for infections.
What percentage of pregnant women actually take Tylenol during pregnancy?
It might surprise you. So it's 40 to 70%
Wow.
of women admit taking it. Now, there's a little caveat to this, is some women just take it here and there. Have they used it at all? Some women take it regularly. And there's a problem called recall bias when it comes to this. So if I asked you guys in the last 9 months, have you used Tylenol? How often and how much? It's hard for us to remember.
Right,
Yeah.
right.
So when we're studying this, it's subject to recall bias because some women, obviously the ones who use it more, tend to say that they use it more as opposed to those that use it intermittently.
Doctors have said that a fever in pregnant women can be very dangerous. Why is that?
It certainly is. So think about what happens to your body when you have a fever. It's kind of an inflammatory response. So it decreases blood flow to the placenta, which can be dangerous. If you have a fever early in pregnancy, even aside from what's causing the fever, is it infection? Is it something autoimmune? Is it something else? It can actually lead to congenital malformations in the baby, including something called spina bifida, where you have problems with how the spine forms and the neural tube forms. So that can be problematic. And late in pregnancy, a fever can lead to problems with labor and problems with development of the baby, intrauterine growth retardation. So the baby doesn't grow normally because the placenta is not getting enough blood flow. So we really advise pregnant women to treat a fever aggressively and also, of course, figure out what the underlying cause of the fever is.
When I was pregnant, I felt like everyone was telling me everything that was like opposite of each other, right? Like it was so confusing to navigate everything. So what should pregnant women do here?
It is very confusing, and the science is still pretty inconclusive. But according to the American College of Obstetrics and Gynecology, we don't have enough data to say that Tylenol is not safe. It is one of the safest options of all the things on the table. So they are recommending what they say is judicious use, which means the lowest dose for the lowest duration. And you don't use it for every ache or pain. We use it for major significant things like fever or, pain, because all of those can also be harmful to the baby if they're not treated. So, I think it's important to make sure we keep that in mind, that every medicine is not bad in pregnancy, but at the same time, we want to be careful because it does cross into the placenta. So animal studies have told us that acetaminophen, which is the generic for Tylenol, can be detected in umbilical cord blood when mom takes it, and therefore baby is also being exposed to it. And they've also shown us that, that can cause oxidative stress and cause changes as well. Again, we haven't proven any causality in humans, but certainly this would be the concern.
Absolutely. All right, Dr. Coley, thank you very much for your insight. We appreciate it.